So, good day, sir. This is the Group 1 MRI case study entitled the MR spectroscopy of the brain, and this is the outline summary. So, MR imaging focuses more on creating anatomical images, while MR spectroscopy it involves analyzing chemical compositions, like it is when protons are in different chemical environments. So, it enables us to perform in vivo analysis of pathological conditions. So, there are three basic steps of MR spectroscopy: listen, Fourier transform, and spectrum. So we all know that each nuclei has a gyromagnetic ratio na unique, and in the chemical shift, this refers to the pattern of differing Larmor frequency. So na difference in resonance, it's because of the electron. The electron is a moving charge particle, and because of that, it generates magnetic field. So in this ethanol spectrum, it consists of three types of hydrogen atoms, each bound differently sa molecule. So bisag they have the same nucleus, which is proton, lahi ilang chemical environment, and that causes them to appear distinct ani nga spectrum. Like they have different peaks. So the differing chemical shifts results from how each hydrogen is influenced by the surrounding atoms, allowing us to differentiate and measure them. So to better understand the chemical shift, focus ta sa shielding sa nucleus. So when we say the shielded nucleus, meaning there's an absence of electron or the proton is isolated. Now there's a larger resultant field because of the lower electron density, and thus it provides less protection from the external magnetic field. And then ang absorption niya mo shift siya downfield, meaning if downfield, higher chemical shift, higher ppm value sa spectrum. In the shielded nucleus, meaning there's an abundance of electron. So smaller ang resultant magnetic field because higher man ang electron density. So much needed for larger induced na magnetic field, kaya ma-oppose man siya sa external magnetic field and mas ma-reduce iyang effect. Now, if the absorption niya mo shift siya upfield, kay lower man iyang chemical shift, meaning because sa electron nga nag-generate with other na magnetic field, and thus it appears to have a lower ppm value. So, in summary, the shielded nucleus, low ang electron density, so downfield siya, and then that's why high iyang ppm value. In the shielded nucleus, meaning high ang electron density, so upfield siya, kay lower man yung chemical shift, meaning it has a lower ppm value.
So for these spatial localization techniques, there are two commonly used techniques, which is a single voxel and multiple voxel. It has a different usage and also functions. For a single voxel, from its name itself, it only acquires a single voxel or a specific 3D region of the tissue, which is also commonly used in 2D stem and press pulse sequences. It has a high signal noise to ratio since it acquires a small specific region of the pathology. However, it's lacked in tissue in heterogeneity since it only focuses into a specific localization. However, the multiple voxel techniques, otherwise known as DCSI, is the chemical shift imaging, which acquire multiple spectra in a 2D to 3D, which with this it can create a metabolite map, which is useful for in pre-surgical planning or clinical usage. So for the pulse sequences in MR spectroscopy, there are actually two commonly used sequences, which is the steam and the press. For stimulated echo acquisition mode, it uses a 390 degrees RF pulses, and it has the typical parameters of echo time of 10 to 30 ms, which has a short echo time ideal for T2 metabolites, and it is also useful for research, for conducting research, since it is less sensitive for G-coupling and susceptibility artifacts. We have also the point resolve spectroscopy, which uses 190 degrees RF pulse and followed by two 180 degrees pulses. Pulse sequence is commonly used for clinical imaging since it has a longer repetition time, which acquire more variable spectra of metabolites. This tool actually uses both a chest technique or chemical shift selective saturation, which is useful for water and fat suppression. Same in a conventional MRI. For MR spectroscopy, we also have extrinsic and intrinsic parameters, which for extrinsic, which is the echo time, repetition time. So in MRI conventional, we actually acquire for fat and water, but in spectroscopy, we suppresses it, which highlighted the T2 metabolites and also the T1 metabolites. For echo time, you usually use a shorter echo time in order to acquire or accentuate the T2 metabolites. Why lesser echo time? Since this short T2 metabolites has a shorter echo time. So in order to acquire them, you use short echo time, which is the decay or the transfer magnetization of that metabolite. For repetition time, you also use long repetition time in order to have better accuracy and also wide variety spectrum of metabolites, which is useful for clinical imaging, and for shorter echo time for specific metabolite, which is useful for research.
So now, we will discuss the MRS procedure simulation or the spectroscopy simulation on the machine. So assuming that the patient was already positioned in the machine, the next step is to acquire a weighted image as some sort of localizer. So per se, we will use a T2 weighted image. And then the next step is to adjust the image resolution parameters, which technically would depend on the protocol set up on the machine. Usually, spectroscopy cannot be combined with images when distortion correction is on. So it can either be a 2D or 3D image, and the distortion correction is usually off when doing spectroscopy, but it would still depend on the protocol set up on the machine. So now, when we are browsing for the procedure, we will select the spectroscopy and particularly the head procedure. And then after selecting our procedure, we can choose what sequence we will incorporate. So depending on the physician, but the SVS is usually for targeted high SNS or the high signal to noise ratio, while the CSI is a summarization of multiple metabolite distribution over a larger area compared to the SVS. In a hospital setting, the 135 sequence is a more common sequence selected, and for simulation purposes, we will follow that sequence. So this is how a CVI should look like, and we can now acquire and adjust our volume of interest and the voxels. So as discussed, fat and water should be suppressed, so when we are selecting our VOI, we should try to keep our voxels within the brain tissue and away from the bone or the scalp. So it keeps our VOI within the tumor area. Upon acquiring the images, this will give us two images. So first is the original image with 2D distortion labeled as DIS 2D and the no distortion image labeled as ND. So similar to that, we can also choose what we would like to image in our SVI or the single voxel, as well as adjust its parameter. So in the next slide, we can see the selected VOI or the volume of interest, which is represented in the yellow box. Once we finish selecting our VOI, the sequences, and the resolution parameters, we can now process our images. So in the application browser, let's select our preset and run the same sequences as we have selected from before. So now we will have a spectrogram which shows both our volume of interest and the metabolites detected in the region. So for the CVI, using the cursor or the cursor from the mouse, we can determine the specific metabolites in the area we have selected per voxels in the region. For example, in this slide, we have selected one box and it showed us the detected metabolites in that specific box that we have selected. And when we select another box, which is shown in the next slide, it will show us a different graph of metabolites in that specific voxel. So this is important as this can be used as basis for comparison when diagnosing an abnormal metabolite level to the adjacent normal tissue concentration. So after acquiring, we can now save the acquired dataset. And when we are viewing a spectrogram, we can also choose to show specific metabolites as well as the selected intensity. Specifically, when we select a specific intensity range, only those in range can be shown. So for example, in this slide, we have selected a 20 to 100% range and the metabolites are the choline and the NAA. Only those in the range or only those that we have filtered will be shown, and below or outside of that range is discarded and will not be shown in the image. So with 5% intensity range, we can see more metabolites in other areas compared to the 20% intensity range. And with 0 intensity range, we can see all the metabolic concentration levels within the voxels in our VOI. So with this approach, we can clearly localize where and which area has an abnormal metabolic concentrations. While in the SVS, the only selected single voxel will demonstrate the metabolic activities. So the SVS is a more specific spectroscopy approach compared to the CVI, and it delimits metabolites of the surrounding area to be detected and shown in our spectrum. So it is a bit impossible to do a comparison to other areas surrounding the possible pathology. So in summary, this is the difference between the CSI and the SVS results. So as you can see in the SVS, we only have a single voxel, while on the CSI, there are many or multiple voxels contained within our VOI. For our next topic, we will be doing the graph analysis. So this is an example of a brain spectrogram. It is consisted of a graph showing different concentration levels of different metabolites detected within our voxels. So for a normal spectrogram, first it should show an ascending graph with what we call a Hunter's angle. So the Hunter's angle is consisted of 3 metabolites, namely the NAA, creatine, and the choline. So the NAA or the N-acetyl aspartate should have the highest peak in the brain or in a normal brain with a 2.02 ppm, and the creatine should have a 3.02 ppm, and the choline should have a 3.2 ppm. So the NA, creatine, and choline peaks form a straight line and corresponds to an angle of 45 degrees, which determines normal from an abnormal MRS. So that is what we call a Hunter's angle. So it is one of the most common and most easiest way to determine abnormal concentration when a graph shows a descending data rather than an ascending data of metabolites. Now that we can read the graph, we will be reviewing the summary of related pathologies and most common metabolites according to Radiopedia. Due to time constraint, please feel free to pause the presentation to review a more detailed information on the potential pathologies associated with varying metabolic concentrations.
So in application to a specific pathology for the MR spectroscopy of the brain, we have here the glioma. Glioma is a common type of cancer in brain which accumulates for the 30% metastasis of the brain which came from the glial cell and 80% for the CNS. For glioma grading, we have two types. We have the low grade and the high grade. For high grade glioma, as you can see from the graph, it has a elevated choline, means that there is a high cell turnover, which means the formation of tumor is possible, and slightly reduced NAA, which means that there is a neuronal destruction because of the action of this normal cell into the tumor. And aside from the choline and NAA, we have also slightly increase of the lactate and the lipids, and creatine for metabolic energy standard, or slightly reduced or stable creatine. As you can see also for a low-grade glioma, it has elevated choline, but the difference is it doesn't have elevation of the lipids and the lactate. However, there are also a slightly elevation of NAA for low grade and the Mayo. Clinical practice, a typical glioma MRS protocol uses a conventional MRI in pair with the multivoxel imaging or the CSI to acquire a spectra from multiple contiguous voxel within a defined slice, which provide a spatial mapping for the metabolite distribution, as you can see from the graph. And for the specific parameters, the TE, the TR, and also the voxel size will be tailored based on the clinical question and the characteristic of the tumor and the scanner capabilities, which is useful for tumor heterogeneity, infiltration, and grading and diagnosis.